This is J. Randall Wilkerson, the author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 26 of a 58-part video series of the entire book, chapter by chapter. Please review our introductory video in the channel for the background information. Part 26 goes into Chapter 5, Enzymes and Supplements, and the subchapter is Omega-3 oils and calcium supplements. Many doctors recommend taking omega-3 fish oil supplements in the form of capsules. After extensive review of every clinical trial, many of the clinical studies found no benefit. A few found a small benefit of 6% to 10% or so. That's a fairly limited response, and as such, it is not recommended as a necessity that you take fish oils or capsules of oils. Now, omega-3 oils are extremely healthy because they're non-inflammatory, and they need to be taken as a ratio with omega-6s and omega-9 oils. That will be covered later in another chapter under fats, under Chapter 8, Diet. The key issue here is quantity. Omega-3 oils are very efficiently converted into energy by the heart, but they have to be in volume. A 1,000 milligram capsule is just 1 gram. A single US 5-cent nickel is 5 grams. So you can see there's almost nothing to a single capsule of omega-3 oils. It's important to keep in mind that clinical studies have certain error rates. 5% plus or minus error rate is quite normal. So if you have a 6.5% improvement, it could be 1.5% allowing for error. Therefore, most of the recommendations in this book involve clinical studies that provide 20, 30, 50, even to 95% improvement in outcomes. The next item is calcium. It's important to gain calcium in your diet through foods, but do not take calcium tablets. One clinical study showed that calcium tablets increase risks of heart attack. This created quite an upset among the medical community that recommends calcium for treating osteoporosis. Counter studies were conducted to try and deflate that response, and some reported no heart attack increase among men and women. But one thing is certain, calcium tablets have not been proven successful in treating osteoporosis. Calcium uptake in the body is regulated by magnesium quantity in the bloodstream, not the amount of calcium in the bloodstream. When you take it as a dietary supplement in the form of food, it's a nice gentle intake and it's absorbed readily. When you take a slug of calcium in the form of a tablet, it shocks the body system as it comes careening down the bloodstream. So take calcium in dairy products, in yogurt, fresh vegetables, meats. That's the best way to take it in. Do not increase your calcium intake with tablets because some persons have reported unstable heartbeat rhythms or arrhythmias triggered by calcium. In fact, doctors even prescribe calcium channel blockers to try and fight that result. So take your magnesium, consume your calcium in a normal manner way of food. This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available from Amazon in print and Kindle editions, from the Apple iTunes Store in an iBooks edition, from ePay as a print edition, and from the publisher Wilkerson & Hughes, P.O. Box 777, Altoona, Florida, 32702. Just enclose a check for $24 to cover the book plus shipping and handling. Thank you for listening.